Hi and welcome to the Health Information Systems Symposium 2019 in Orlando. I'm Dez Blanchfield and I have the pleasure to catch up with Maria Lenzing, who's the Vice President of Healthcare Solutions at AT&T. Hi Maria, how are you?
I'm doing great, Des. Thank you for having me today.
Well, and thank you for having me on your booth. It's an amazing week, and just looking around us, there's an enormous turnout here. And the thing that really strikes me is this amazing journey that people can go through on the floor here. But before we kick off, one thing that a few people may be wondering is, this is a healthcare symposium, a healthcare event. It doesn't always seem natural that AT&T's here, but I mean, AT&T is all through all healthcare industry, aren't you? I mean, tell us that natural fit between sort of what AT&T Healthcare is doing and what the industry as a whole is doing.
Well, thank you. Yes, and you know, we always get the question, what is AT&T doing in healthcare? We are the connectivity platform that fuels the innovation that everybody here at HIMSS is trying to drive within their healthcare systems. Right? They need to connect, they need to bring these clinical applications, the solutions around the healthcare space, anywhere they need them, and we are that fuel through our platform.
And there's some very big challenges for them. I mean, hospital infrastructure and the healthcare space in general, there's some big sunk costs and infrastructure, equipment, things that go beep. And then there's I guess the mobility piece around there, the networks, the wide area network connectivity, the LANs and now Wi-Fi. This seems to be a very big challenge for a healthcare provider where it seems to be a non-natural thing for them. And I think this is where AT&T, in my mind, with your healthcare practice is a perfect fit, because you can let them focus on being the hospital and the healthcare provider, or the infrastructure provider, and solve a lot of those very big challenges for them and maintain and support them and monitor them.
I couldn't agree more. I think it's time for all the different healthcare administrators and leaders to move from education to application.
I like that.
And it is essential for you guys to get there. Why? Because these applications in healthcare, through the consumer side, are starting to penetrate the hospital walls. So what we're doing here at AT&T, we had big announcements this morning around bringing that education to application with 5G, right? We've announced before that we're bringing 5G testing into a medical space, so with Rush Clinic. So no longer is it just, hey, can we test technology in a technology lab? It's about testing medical applications in a medical environment.
And there's no substitute for getting things in the field, is there? Because you can only simulate so much in a lab.
Correct.
And so many other things happen when you're in the field and in that hospital, and human interaction and then the other devices, and I mean, that must be an interesting experience for them as a AT&T partner to sort of look at, okay, we're coming out of the lab, we're coming out of the development, what does it actually look like when we put it in the field?
Exactly, and we need to get ahead of that. We need to understand what works, what doesn't, and we can then share that learning, right, with the broader healthcare ecosystem. And then we can do that, you know, that's right behind us is the other announcement around augmented reality and virtual reality in a hospice environment. So we partner with VITAS to do pain management by bringing some people that can't physically move someplace to that location. And I'm bullish about it, because one of the pieces that they're doing is showing Peru, and I'm originally from there, so you can go to Machu Picchu via virtual reality. And have somebody do a bucket list that couldn't move before. And that's the kind of things that we need to do, again, in clinical settings, in healthcare settings, not in labs.
Now, you've got a number of announcements. What can you share about some of the other announcements you've had here today with regard to the HIMSS 2019 event?
Well, like I said, we're bringing these different educational topics into realities and applications in healthcare. We also announced a couple of more 5G cities this morning. So Minneapolis and Chicago, 5G in 2019 for you.
Congratulations.
Yes, we're very excited about that. We have a couple of examples. I think you got a chance to talk to a Voliport CEO this morning.
Indeed, I did.
So, you know, for some of us that worry about our weight and we kind of measure ourselves, yes, you know, have to be healthy. You know, it starts with wellness. So now you can use that same scale to actually measure your vitals as well.
I found that fascinating.
Isn't it? Because I mean, why not, right? Let's make sure that you're not just losing weight, but that everything else is also there.
And I also like the transition, and I think this is a big part of what you're doing with the organizations in the health industry you're working with, is getting them out of that reactive mode and getting into preemptive mode and planning ahead, predicting. And I think the example you gave of Bodyport with the intelligent scale, you're taking a traditional scale, now giving it the ability to sense things like, you know, heart rate and other things from the foot. So you don't have to wear lots of things. And then look at this longitudinal data over time and see how there are any changes. And I guess this is something that also is possible with what you've got, because you now put these things in different data centers and different cloud platforms and not have to have all that infrastructure.
Yeah, and you know, the thing is, what I love about what we do is, for these healthcare leaders out there, you guys know healthcare better than anybody else. but we know technology better
Yes.
than anybody else. It's coming together, understanding their vision, understanding where they need to go, and working with them to bring technology to power that vision and make it a reality, so that that CIO that, to your point, has
Yes.
to every day manage the operations of a very complex environment, doesn't have to go and hire a specialist on identity or security
Right.
or for all of these technologies. Let us help you because we can. So that's what we do.
And it also allows people to stick to their core business, I think, because the challenge historically has been that there may not have been somebody like AT&T to do this for people, so they've had to build their own security, their own database, their own systems, own networks, and a lot of devices weren't able to be connected. They set it, like we always see in the movie the classic sort of thing of a person walking up and down with a pole with a drip on it, and that's the only way to move from room to room. Now we're seeing different things that you're doing with people where they've got little smartphone size things that can carry the data with them, do it over the AT&T LTE-M protocol. So where are you seeing the biggest shifts in this space? I mean, I know there's a lot of them, but are there any key ones that just jump out of you that you can share around what's happening with the digital transformation challenge in the healthcare space, particularly hospitals? Where are the big shifts taking place, and how's AT&T playing a part in that?
Yeah, I mean, some of the shifts are definitely empowering AI, robotics, right, innovation. That's definitely driving a certain behavior, let's say, in healthcare. You also have other environments that are permeating this space, like telehealth, right? How do I do that? You and I talked about IoT, all these things that are connected. We're in this very interesting intersection, right, where technology, connectivity is cheaper, the form factor of chips are smaller, so now you can have things that are going to be subcutaneous, so they're going to be implantable, and they're going to be connected, and this data intelligence and analytics, and that's where AI becomes extremely important. So now the doctor, instead of having to sit down for 15 minutes to read somebody's history, we can have a wearable that is going to be able to load information. The doctor is going to get the report out to say, hey, so-and-so had a stable, the benchmark shows the same, but on these two situations, we had spikes. And by the way, the GPS told us on those two moments, this person was at this place and this place. So the correlation of what's happening, right, and how it's affecting their health, that's going to be incredible.
Such a game changer.
And the technology is here, it's just not in healthcare.
That's the thing that struck me. I mean, I'm literally seeing it here today, and everyone I'm talking to, including yourself, you're talking about it here and now, not tomorrow. It's not like the George Jetson sort of science fiction, right? You're already doing it, it's out there. And you've rolled it out through a significant number of clients and partners, from what I understand.
Yes, and that's kind of the announcements that we've done. We are bullish about bringing the technology into the healthcare space. So for those innovators, and there's many amongst people here today that want to go move forward with where we're heading, we're there for them. I understand that we have to be careful. We're dealing with lives, Dez. This is not something to play around with, but we're also looking at improving the patient experience, the patient outcomes, and allowing for the longevity of those lives that we care about, right? So I think, again, 5G, robotics, augmented reality, virtual reality, what that does, that's IoT and everything that the data that comes with it, all of that I think is going to revolutionize healthcare. And then ultimately the big thing that you and I have talked in the past about is the consumerization. Right? The consumer and what they experience, they're going to want the same from healthcare. So that's where I believe our different leaders out here today, and especially those at HIMSS, they need to start thinking about how do I prepare my platforms, so my connectivity, my network that they manage as CIOs, how do they get that ready and flexible so that any innovation that happens in healthcare can come into their walls easily and be deployed faster to their population?
I love it. And the thing, the sense that I'm getting from this is that it makes commercial and a social sense to start that conversation sooner than later, right? Don't get to the end of the maturity curve and say, oh, we need this thing. Get on the phone, go and meet with your AT&T rep, salesperson, pick up the phone, talk to you as early as possible, bring you into that conversation so that they can avoid some of those pitfalls that you already know because you're doing it out in the field already. Yeah,
I mean, I don't think a CIO can afford to hire an expert in cybersecurity, an expert in AI, an expert in all of these different technologies that they should learn about. But we have them, right? We have 140 years of a legacy of innovation in technology. Use us. We're going to be the first ones to tell you we're not the best at this because we're going to stick to our core competencies. but we love to also be connectors of peoples and companies and partners, and so much innovation that's taking place by kids, right? Working with third-party technology, and they have these great ideas. They've had small applications, they have a small patent. Can we come together, a healthcare solution, a healthcare provider, us, and this is a small company, and bring and revolutionize the space? I think it's possible. We've done it. We're seeing it over and over again in our innovation centers, the foundries. So come talk to us. We are going to be the first ones to tell you what we can and cannot do, but we are so committed to the success of healthcare because ultimately we will improve our communities. The better that these guys are at what they're doing and extending the care beyond the four walls of a hospital, we will improve the communities that we serve. And that there is no price on that. There's no we shouldn't even think about it twice. That's what we all are here to do. So,
well, it's an exciting future, and I feel a lot better about my own health now. Final question for you. What's healthcare going to look like in 3 to 5 years?
Oh, gosh, I don't know that I could say anything 5 years from now because technology is moving so quickly.
Right.
But I do believe that that healthcare of 3 years is going to be at my hands. It's going to be on my terms as a patient. I'm going to have my medical records follow me. I believe my doctor is going to be more intelligent about my data because he's going to have applications that tell him where I've been, what I've been doing, and have that continuum, right? From anywhere from having been hospitalized to having had a surgery to how I'm doing this from my regular wellness perspective. I also believe there's going to be a consumer aspect, Des.
Right.
I think that we're going to start seeing some retailers get involved in these things. So, for example, your shopping habits, right?
Good point.
Do they kind of influence the kind of healthcare that you're experiencing?
Yeah.
So we're going to move into wellness, and we're going to have a different type of operating room in the future. Doctors are going to have tools, whether that's robotics or just augmented reality or virtual reality to help them do what they do best. We're going to have a better lifestyle for them as well. Such ease for those nurses that are trying to look at the rooms that are available. The entertainment in those rooms is going to be everything, customized. So again, it's just about the patient, about improving their outcomes, and all the technology around them is just going to be different.
Well, Maria, it's been absolutely fantastic to catch up with you here at the HIMSS 2019 event. And thank you so much for being on my podcast the other day. It was great to have you as a guest. And hopefully we'll have you on again.
Thank you. Anytime. I love talking to you.
Fantastic. Well, folks, thank you very much for joining us. You've heard some amazing insights from Maria Lenzing from AT&T. She's the Vice President of the Healthcare Solutions. And we'll look forward to seeing you in the next video. Thanks for joining us.